Hello everyone, I am Dr. Ajesh robotic and laparoscopic cancer surgeon, and today I am going to talk to you about some important risk factors for esophageal cancers. Now, there are two common cancers which can occur in the esophagus. The most common cancer that we see is the squamous cell carcinoma, which accounts for more than 70% of the esophageal cancers. Now, these squamous cell carcinomas develop from the cells that line the esophagus. So, they constitute the lining of the esophagus. And these cells can get damaged because of various factors. Now, let us see one by one what are the factors that can damage the cells in the esophagus. The first and most important contributor for these esophageal cancers is smoking. When you smoke, which can either be in the form of cigarettes, you can have non-smoking forms of tobacco, which is like gutka, zarda, pan, and the other various factors of tobacco which are very commonly available. And many people who smoke also consume alcohol, which can again be in many forms such as beer, whiskey, wine, any other form. Now, both of these factors are important risk factors for contributing towards esophageal cancers. By risk factors, I mean that when they individually increase the risk of esophageal cancers, and when both of them are used together, they combine and synergistically increase the risk of developing esophageal cancer much more. Now, other things that can damage the squamous cells in the esophagus are when we consume hot foods or hot beverages, like having a hot coffee, hot tea, or drinking any hot beverages. They can also damage the cells that line the esophagus. Now, very rarely we see patients who can have some sort of caustic injury, which can be because of acid or alkali. Now, these are commonly found in bathroom cleaners, things that acid which is used to clean the toilet, or any detergents and other chemicals which people may consume, and that can damage the esophagus and cause strictures which gets narrowed, and over a long period of time when those strictures are left like that, they are also at risk for developing esophageal cancers. There are some infections also can contribute. Apart from that, having foods which have low nutritional value and consuming less fruits and vegetables can also contribute towards development of this type of esophageal cancer. Now, the other type of cancer that we see is the adenocarcinoma, which accounts for about 30% of the esophageal cancers. Now, adenocarcinomas occur because of a condition called as chronic gastroesophageal reflux disease, or GERD. What we mean by that is when the acid in the stomach refluxes back into the esophagus. That means you can have the acid which is normally meant to stay in the stomach, it keeps coming into the esophagus, it damages the cells in the esophagus. That damage can form cancerous changes in the cells that line the acid. Over a long period of time, that can cause the chronic reflux, can cause a condition called as Barrett's esophagus. The cells that line the esophagus change into that of the intestine, and that is again an important risk factor, because when Barrett's esophagus is left alone over a period of time, they are going to change into cancer, what more commonly the adenocarcinoma type of esophageal cancers. Now, being overweight is again a risk factor, where you can also have a sphincter, the gastroesophageal sphincter, that is lax and allows that acid to keep coming back into the esophagus. Apart from that, being elderly, beyond 50 years of age, and even the males have a higher predisposition for developing esophageal cancers. So, if you are beyond 50 years of age, if you are a male, if you drink or smoke, if you are obese, if you have long standing acid reflux or gastroesophageal reflux, or what we call as heartburn or acidity, then it is important that you get yourself evaluated. And if you have any of these symptoms, that is difficulty while swallowing, difficulty if you feel like there is some sort of food which is stuck in your throat, so if you have any of these symptoms, please consult a specialist nearby, and do like and share this video so that we can increase the awareness. of esophageal cancers.